Medical terminology, chapter 14, this is the musculoskeletal system. The types of muscles that you are going to need to know on your exam are three types: cardiac, skeletal, and smooth. The other thing that you're going to need to know is whether they're involuntary or voluntary, which means can you force them to move or do they move on their own? So cardiac is involuntary, skeletal is voluntary, and smooth is involuntary. With the cardiac, hopefully by this time you know that that means the heart, so that is where your muscle is. You cannot force your heart to beat. You can make it go faster and slower due to adrenaline and other issues, but technically you cannot force it. Skeletal system, you can move. Your mind can tell a muscle or a ligament to move to be able to move that skeletal muscle for you. And smooth are your internal organs. You cannot force your body to digest or process any foods a certain way. Okay, muscle directions of the muscle: the rectus, transverse, and oblique. The rectus is straight up and down. Transverse goes straight across the body, and oblique goes in a diagonal vert. The ways muscles are named are by action, location, direction, origin and insertion, numbers, shape, and size. So for actions, you might have an abductor or an adductor muscle that's moving it away from the body or towards the body. It may be the location, so maybe the radialis muscle. A direction could be the direction that the body goes in. Origin and insertion is where the muscle is originally begins and then where it ends. So for instance, the radialis ulnaris starts at the radial area and ends at the ulna, at the elbow. Numbers could be something like bicep, tricep. Shape could be something like trapezius. Size is going to be something like major or minor. Action muscles. Abduction is defined as moving the muscle away from the midline of the body. So if I was to raise my arm up to my side, away from my side, then that would go up and out to abduction. Adduction is bringing that arm down towards my body. It's adding to the body. Inversion means that it is turning the soles of the feet inward. Eversion, the soles of the feet are being turned outwards. Extension allows me to extend, like for instance, my arm out to reach for someone. That is my extension muscle. Flexion, if I was going to flex my bicep, and that would decrease the angle of my joint, so that's going to bring my arm towards me. Pronation allows the palms of the hands to face downward. Supination allows the movement of the palms of my arms to go upward. And rotation allows the bone, this is the muscle, moving the bone around its longitudinal axis. Medical terminology words you're going to need to know in this chapter are arthro, kinesio, and osteitis. Abbreviations are listed here, and then in this next one we're going to be going through the skeletal system. You will need to know all of these skeletal systems, all of the bones of the body, in order for you to take the final. So for instance here, you can look at the very top, it's numbered. I'll start with the ones there. It just means that you have one frontal bone, that is your forehead, and goes toward the midline of your skull at the top. Occipital bone is in the very back of your head, and you only have one of those. You have parietal bones, which are on both sides of your head, right above your ears. And then right around your ears is your temporal bone. Then, second layer kind of the skeletal system is you have something that looks like a little Batman mask. That is your sphenoid bone. And then there's another bone that helps protect your nasal area and your brain is your ethmoid. Then in your face, you've got several bones there. The nasal bone at the very top there is where the bridge of your nose where your glasses would sit. Your lacrimal bone is where your tear ducts are on each side of your nose and close to your eye there. The zygomatic malar is your cheekbone. The concha or conchi is up inside the nose. It helps keep the nose open, the nasal passages open, and protects that area there, but it's up inside. This illustration does not do a good enough job on showing you exactly what it looks like. So if you ever get to see a skeleton, you know, one of those mannequins that we have that are skeletons in a lot of your health classes, look up inside the nose so you can see where the concha is and what it looks like. Your vomer, bone in your nose, is in the middle of the bone right where your septum is, what separates your right and left nostrils, and that little bone there is what holds up that septum or supports that septum. Your maxilla is your upper jawbone, and your mandible is your lower jawbone. The palatine is the roof of your mouth, and you actually have two. And if anybody is born with cleft palate, it means that that roof of your mouth wasn't formed appropriately inside the womb. So that is what a cleft palate is. Bones of your ear are the size of a piece of rice, and it goes exactly the way that this illustration is. Malleus, which is the bony protrusion there that's kind of round. In the middle is the incus, and then at the very end is your stapes. They have words underneath them, hammer, anvil, and stirrup, to help you remember the terms. It may or may not help you. Now, the bones of the neck and the trunk. You have one floating bone in your body, and that is a hyoid. The hyoid is actually shaped like a horseshoe. In this illustration, it shows you just a side view, but it's actually the shape of a horseshoe, and it protects your neck. Your sternum, which is your breastbone, is directly in the middle. It's where we would push for chest compressions if you were needing CPR. And then off to the side here in this illustration, it shows you all of your ribs. Okay, this is your vertebral column, so it's your back. And if you look at the diagram here, it says 7 cervical vertebrae. Then the next set is 12 thoracic vertebrae, and then 5 lumbar vertebrae. You have 1 sacrum, but it's actually 5 fused bones, and then it solidifies as you get older. And then you have 1 coccyx. On this, to remember what your vertebrae numbers are, if you think about having breakfast at 7, lunch at noon, and dinner at 5, it will help you with these numbers. It also, on the test, you will need to know how many vertebrae you have in each column. Then we go on to the upper extremities, which is your arms and your shoulders. So your collarbone, the very front of your body there, is your clavicle. Your shoulder blade is called a scapula, that is in the back of your body. Then the very large bone of your arm is called your humerus. That goes from your shoulder down to your elbow. Then if you look at the next set, you've got 2 bones in the lower part of your arm. Remember that the largest bone is the radius, and it will always be on the thumb side. So radius is on the thumb side. The ulna is a smaller bone, and it will be on your pinky side. Your wrist bones, which you have 8 in each hand, are called carpals. The part or the flat part of your hand, or your palm of your hand, from the palm of your hand to your fingers is called metacarpals. You have 5 of each in each hand. Then phalanges, which are your fingers, you actually have 3 phalanges in each finger and 2 in a thumb. So we're going to go over the hand just a little bit more in detail. Your wrist, which is your carpals, you have 8 wrist bones. In your hand, you have 5 metacarpals. Your fingers, which are also called your phalanges, and if we talk about one of the bones, it is called a phalanx. You have 14 in each hand. The way we describe the fingers or toes, or let's say you broke a finger and it was the middle finger and it was the tip. On your x-ray, it's going to say 3rd distal phalanx fractured. So if you look at the way that the numbers go, you start with the thumb, doing 1, 2, 3, 4, 5. This gives us a better description, and when someone's reading an x-ray or a description of an injury, this is how we would describe it by 1, 2, 3, 4, 5 phalanx or phalanges. Then we go on to your lower extremities. Now, this textbook is a little bit more basic, so it calls your hip bone a hip. You do need to know that it is iliac is more the term that we would use, and then we use other terms as well down the line, but I don't want to go into too much detail. Your largest bone in your body, and where we will usually get, if we need to get a biopsy of bone marrow or you're donating bone marrow, we'll get it in your femur. This is the largest bone and has the most marrow that produces your red blood cells. So femur is your thigh. Patella is your kneecap. It technically is not considered floating, even though you can move it around and it's supposed to be movable. Your shin bone, or the largest bone of your lower leg, is your tibia. And then the smaller leg, the tibia holds all of your weight. The fibula helps you balance a little bit more so you're not walking on stilts. So the fibula is on the outer portion of your leg. Your ankle, which we sometimes don't quite understand that we actually walk on the ankle. It is our heel and 6 other bones included down there, is your tarsals. So you have 7 tarsals or ankle bones in each foot. Then the flat or the arch part of your foot is your metatarsals, and then your toes are called your phalanges. And we go over the toes just like we do the fingers. The big toe is number 1, and then the pinky will be number 5. So we go through this again where you see where your tarsals are. I don't know if you realize that you are walking on your ankle. Then the foot where it has the metatarsals, this is where your arch is at, and then your toes. And again, even your pinky toe has 3 bones. Your big toe only has 2.